with the invention of computers and of late, as we all know, mobiles. So from the time we get up to the time our hands are always in motion. So to discuss about the common hand ailments and the treatment of these ailments and also the prevention, we have with us very eminent, renowned orthopedic surgeon of Siliguri working with Medica North Bengal Clinic, Dr. Pratik Agarwal. So over to you, Dr. Pratik, to take the session forward.
Thank you, Dr. Gaurav. It is indeed a pleasure for me to be presenting a topic on ailments of hand today. Thank you. So I'll be starting soon. Is my slides visible to all?
Yes.
Okay. So good evening, everyone. I am Dr. Pratik Agarwal. I am a consultant trauma and joint replacement surgeon associated with Medica North Bengal Clinic in Siliguri. Today, I will be talking about common hand ailments. So let's start. So common hand ailments can be divided into different categories. It can be congenital, which are mostly the birth defects. It may be traumatic. It can be either open or closed injuries. Neoplastic, which are mainly tumors. The tumors of the hand may be involving the bones or the soft tissues. It may be infective. Again, it may involve the soft tissues or the bones of the hand. Inflammatory. In inflammatory, the most common ailment is arthritis, and in hands, it's most common rheumatoid arthritis. In degenerative, again, it is osteoarthritis. And lastly, but not the least, is the neuropathy, which usually occurs by nerve compression or injury to any nerve, and miscellaneous. So we'll be discussing one by one, and I'll be telling the brief and the treatment regarding the same. So first is the congenital. So most common condition which we see in hands in congenital defects are duplication of the fingers. As we all are aware of that one of the movie stars, Hrithik Roshan, also have a duplication of thumb. So that is a very common thing, thumb duplication among the hand fingers. And the other condition is syndactyly. That means any two fingers of the hand is partially or completely attached to each other like this. You can see in the fingers also, either it is completely attached or it is partially attached. The condition is known as syndactyly. The treatment for syndactyly is surgical release. There is no conservative treatment. Any patient who has syndactyly, we need to release it surgically. And for the duplication of thumb, in India, it is not major problem, but in cold countries where the temperature goes really quite down and people need to wear gloves, so it is a problematic for them, and we need to remove it surgically. And any professional players like weightlifters or a long jump, pole vault, they also the extra thumb may be interfere with their profession, and in those cases we need to release it, excise it, I mean to say. Second most common, this is one of the most common element, is the trauma to the hand. It can be either an open trauma or a closed trauma. As you can see in the middle fingers, in the middle picture, there is a trauma. You can follow my cursor. There was a trauma in the hand and the wound is stitched, but you can see the radial, the lateral two fingers are flexed and the middle two fingers are extended. That means there is some injury to the extensor tendon of the hand, which has caused the flexion deformity of the lateral two fingers. So in these cases, we need to do a surgical repair of the tendons. As you can see on the right hand picture, we have repaired these tendons, resulting in the straightening of the fingers. So this is one of the most common ailment in hand, that is trauma to the hand. Next is the tumors. It can be either benign tumors or a malignant tumors. In hands, we mainly have benign tumors. One of the most common thing is the ganglion cyst. Many people must have seen this kind of swelling in the wrist area. This is called ganglion. We call it a cyst because it is just a sac which is extending from either of the wrist joint or one of the carpal bones. So it has mainly fluid inside it, and it is soft, and usually it is not painful, but in some cases there is a pain, and if it causes pain, then we need to do something for the cyst. So what is the treatment mainly? In some cases, we can aspirate the cyst and inject some medicine so that the sac shrinks. But in some cases, even after doing this procedure, there is a recurrence of the cyst, and in those cases, we need to do a complete excision of the sac, that is cyst. Second common condition is lipoma. It's a tumor of the fat tumor involving the hand. Glomus tumor, it is seen in the nail bed. Many of the patient complains with pain in the fingers, and many people think that it is because of the cervical spondylosis radiating to the hand, but it is not so. In glomus tumors, there will be specific pain in the nails of the fingers. And last is a giant cell tumor of the tendon set, which do occur, but it's really rare. This is one of the picture which I operated in Medica Hospital. This is the example of the giant cell tumor of the tendon set of the little finger. The other tumors which can involve the bones of the hand are the enchondroma. It is a cartilaginous tumor. You can see in the picture, you can follow my cursor. This tumor here, it can involve this part of the bone. Yeah, so this is a tumor, but it is not an enchondroma, it is a giant cell tumor of the bone, which is the next one. So for treatment, we need to do a surgical treatment for this kind of tumors. We need to completely remove the either the tumor part, if it is involved a single particular bone and it is within the bone. And suppose if it is involving the soft tissue, then we need to remove the entire bone along with the portion of the soft tissues. Second most common is the infection. It may be either an acute infection or a chronic infection. Acute infection, as many of us are aware, that it can involve this pulp of the fingers or the nail side of the nail bed. It is quite common, and in such cases, if the pain is quite if the patient is having severe pain, then we need to put a small incision and then roll the pus. Then we need to start the antibiotics. It is more commonly seen in people who uses who keep their hands wet, or who do lots of dishwashing. It's common in laborers and like dhobi people who wash clothes. So it's quite common in them. The chronic infection, it can involve tuberculosis. In India, it is quite common, and it may involve the bone of the nail bed and fingernails. And the treatment for tuberculosis is that we need to start anti-tubercular treatment, which may last for 1 year. If the patient presents early with tuberculosis, the prognosis is really very good, and it's a complete clearance from tuberculosis after the course of ATT, and they can get their normal hands back to work. This was I was talking about. You can see in the diagram that this X-ray, you can see my cursor. This is the part of the bone of metacarpal which was involved in tuberculosis. Patient presented with a discharging sinus, and hence the course of anti-tubercular treatment was started. And after 1 year, it was a complete remedy for the patient, and she was back to work with a normal hand. Now coming to inflammatory arthritis, which I was already telling you that rheumatoid arthritis is the most common inflammatory arthritis of the hand. It causes different deformities in the hand. There may be swelling, there may be limitation of the movements of the fingers, along with the painful hand. It mainly involves small joints of the fingers. You can see there is also a swelling, there is stiffness, there is deformity, and there is redness even. So you can see in the diagram, there is a deformity of the hand. The fingers have deviated towards the ulnar side, and there is a swelling in the joints of the fingers. You can see here, and all this. So in the initial stage of rheumatoid arthritis, there are multiple medicine options which we have. There are DMRDs, which we call it disease-modifying anti-rheumatic drugs, like methotrexate is one of them, sulfasalazine, leflunomide, and in recent times, many of the biologics have also come, and which have given a very promising result in the treatment of rheumatoid arthritis, like tofacitinib. In very chronic stages, when the disease has progressed to stage when it is not curable by the medicines, then the treatment is limited to surgery. And in that cases, we need to replace the metacarpophalangeal joint or interphalangeal joints, which are very rarely done in India, as most of the patients in India, they accept the deformities and carry on with their life. So these were all these conditions involve hands, but most common conditions which we see on day-to-day OPD basis are the conditions which I'll be discussing now. So one of them is dequadrant tenosynovitis. And the meaning of this is that there is an extensor compartment here. You can see my hand. There is an extensor compartment here, and there is a tendon, and the seat over the tendon get inflamed, leading to the friction, which causes difficulty in the movement of the thumb and pain in any movement of the thumb, and that condition is called extensor dequadrant tenosynovitis. Like you can see this diagram on the right. This is a radius bone, and these are the compartment, extensor compartment. We have 6 of such compartment, but since it involves only the compartment 1 and 2, so the diagram we are showing only 3 compartments out here. So the tendon in these 2 compartment, and this is a sheath, so which gets inflamed and causes pain in the movement of the thumb. So I was already telling about the causes. It usually it may be pre-existing, like since birth, the compartment may have multiple septa, so it reduces the space for the tendons to move, and it causes pain whenever you keep on like using your hand for repetitive movements, like painters or some artist who draws a lot, mouse workers, desk workers, etc. It may be physiological, like in pregnancy or lactation, when the volume of the body increases, so extra volume get deposited in the tendons space, in this compartment space, which limitize the movement for the tendon to move around, and this causes inflammation of the tendon sheath, causing pain. So mainly the extensor compartment, that means the dorsal compartment, this thumb compartment of the wrist is involved in dequadrant tenosynovitis. The treatment is mainly conservative. We need to give good amount of rest, which can be in the form of thumb splint. Drugs mainly are analgesic and anti-inflammatory. We can also use ice compression. And in some cases, when conservative treatment fails, we can give a local sort of corticosteroid injections. It is advisable to give only 1 or 2 shots of such injections, because multiple attempts to give injections can lead to the tear of the tendon, which is more a disaster thing to be done to the patient. Now, many people or many patients have a dilemma of not using the steroids, but I want to inform you all that it's a local steroid, that the steroid injection which we are giving is given in a very low dose and in the local area. So it does not have any systemic side effects, and it reduces the local inflammation, which reduces the friction, and hence the tendon moves around the sheath very normally, reducing the pain. And in some cases, even the treatment with injection is not like helpful for the patient, and in such cases, we need to do the release of the dorsal extensor compartment. As I was already explaining you, the sheath here, you can see my cursor, the sheath here. If it is not relieved by injection even, then we need to cut off the sheath. We need to release the sheath, which reduces the compartment pressure, and hence the pain comes down. As you can see in the diagram, this is a sheath, and with the blade we need to release the sheath. This results in freeing of the extensor tendons, and the thumb movement gets quite easy, and the patient feels relief from the pain. The second most trigger element is the trigger finger. Now, what is trigger finger? Like I was explaining to you, from the from the forearm there are muscles. As the muscle ends, it causes tendon, and this tendon through the extensor tendons goes in the hand and gets attached to the fingers, different fingers. So as it passes towards the fingers, there is a tunnel, and in the tunnel there is a fluid which allows easy movement of the tendon. In some cases, what happens, that the fluid in the tunnel decreases, causing friction. as a result of which there is a locking of the fingers, which is called the triggering of the fingers. Like in the pistol or in the revolver, whenever we shoot, there is a trigger, so it recoils back. So that is why the name has come from there. It's called a trigger finger. So many patients, you will see that there is a locking. Whenever they flex the fingers, it gets locked, and then they need to release it like this. So there is a triggering effect. So it's called the trigger finger. It mainly involves the pulley of each fingers. This distal crease and this distal crease as the pulleys for the respective fingers. So you can see in the diagram also, like this is a site where the friction happens and it causes the triggering of the finger. Again, the cause, it is mainly common in patient having diabetes mellitus or thyroid dysfunctions, also common in patient with rheumatoid arthritis, and those patients, as I was already mentioning you, who repetitive do work. For example, mouse worker and drawing people, artist who writes a lot, novelist, this kind of people, they tend to get this kind of conditions, and it's called a triggering finger. The treatment again is same as that of dequervant tenosynovitis. We can give some rest to the fingers in the form of splint. You can see in the diagram on the right, this is called a trigger finger splint. We need to support, we need to give rest to this pulley out here, and with rest, the inflammation will subside, and the friction, which was causing the tendon to, which was avoiding the tendon to move freely, it's avoided, and hence the tendon moves freely. The medicines are same, like anti-inflammatory or analgesics. Again, the steroid injections, it's a local steroid injection which we can prescribe to the patient. Maximum, again, I was telling that we can give only 1 or 2 of such injections, not more than 2. Maximum shots of injection into the tendon may lead to the rupture of the tendon, and which is again a very painful and disastrous thing to do to the patient. And the other from the splint, there is a physio and occupational therapy. And if all these measures fail, then the only remedy is the surgical release of the A1 pulley. You can see it from the diagram, like there is a pulley, and if even after giving injections, there is no relief. So we do a simple release of this tendon sheath over the pulley, resulting in the smooth movement of the tendon. Like all these operations are done under local anesthesia. All these procedures are daycare surgeries. We no need to admit the patient in the hospital for these procedures. Patient can immediately use their fingers or hands after the surgery. It's a very simple procedures, and we routinely do this kind of procedure in our setup. The another most common condition is the carpal tunnel syndrome. Now, what is basically a carpal tunnel syndrome? For this, we need to understand what is a carpal tunnel. So carpal tunnel is like a tunnel-like structure which is present in the wrist. You can see in the diagram on the left, this is like a wrist, this axial section of the wrist, okay? And these are the carpal bones, you can see. And on the volar aspect, there is a tendon sheath, which is called the extensor tendon sheath. So all the tendons of the forearm muscles passes through this tunnel and going into the hand. So you can see all these white structures. These are the tendons of the muscle which are going into the hand. And among these tendons is a median nerve. So any condition which will lead to the swelling of the wrist will reduce the space of the tendon, causing the nerve to be compressed, as a result of which the area which is supplied by the median nerve, that is mainly involving the lateral 3.5 part of the fingers, will have a tingling sensation, numbness, pain. So this is called a carpal tunnel syndrome. So this is the compression of the median nerve in a carpal tunnel, causing tingling, numbness, pain in the lateral, like this is 1, this is 2, this is 3, and this is half. Lateral 3.5 part of the fingers and hand. If the condition is chronic, like it may lead to the weakness, and the muscles of the thumb, like thinner muscles, to get weak or atrophy. You can see in a very good diagram on the right hand side, this is the extensor tendon. So all the muscles, tendons passes under this extensor tendon, and this part is only called a carpal tunnel. So there is a nerve, which is a median nerve. So any condition which will cause the inflammation of the tendons lead to the compression of the median nerve, leading to carpal tunnel syndrome. So what are the causes of the carpal tunnel syndrome? Most important cause is genetic, like people from birth have a small carpal tunnel, so it may lead to the carpal tunnel syndrome. Again, in pregnancy and lactation, these people, these pregnant and lactation ladies, the body tend to swell up, causing the inflammation of the tendons also, which reduces the size of the carpal tunnel and hence causing the compression of the median nerve. But one good thing is that as the pregnancy subsides, within 2 weeks to 4 weeks to 1 month, the pain and the tingling sensation of the hand also reduces. The carpal tunnel is also commonly seen in patients suffering from thyroid disorders, diabetes, rheumatoid arthritis, and those who continuously or do the repetitive stresses on the wrist. For example, keyboard users, painters, household workers, and road drillers would keep on drilling the machine with this automatic machines, which causes repetitive stress on the wrist, leading to this carpal tunnel syndrome. So diagnosis is very simple. It's clinically, it can be done clinically by some provocative test. These are the examples. Like one of the tests is that we can press on the wrist and ask the patient whether there is a tingling of the lateral 3.5 fingers. If the patient says yes, it may be one of the reasons of the carpal tunnel syndrome. The second, in the chronic case, we can see there is atrophy of the thenar muscles. If there is atrophy of the thenar muscles, that indicates, you can see in the diagram on the right, left, this part very nicely shown with the arrow. There is atrophy of these muscles. As the muscle is supplied by the median nerve, so prolonged compression leads to the atrophy of these thenar muscles. And there are some good diagnostic tests to identify carpal tunnel syndrome. Some of them are nerve conduction study, which we call NCB. Imaging, ultrasound, X-ray, or MRI may help. And as I said, it's common in patients suffering from diabetes mellitus, thyroid disorders, rheumatoid arthritis. So we can get the blood test to rule out these disorders. The diagram below is nerve conduction study, just to find out whether the patient is suffering from carpal tunnel syndrome or not. Again, the treatment in the early stages, some exercises, the stretching exercises of the hands, which causes the extensor retinoculum to stretch, releasing the pressure from the carpal tunnel. So it may be useful. Splint, as you can see on the diagram on the right hand side, this lady is using a wrist splint, which reduces the pressure on the wrist, leading to release of the pressure of the carpal tunnel and hence the pain. Some lifestyle modification, which I'll be coming to you next, and ergonomics. In this also, suppose if it's not getting relieved by some exercises or wearing splint, we can push 2 shots of steroid injection at a gap of 6 weeks. If it's not relieved even after the injection, then we can do surgical release of the extensor retinoculum. It can be done either by open surgery or it can be done also by arthroscopically. Again, it's a daycare surgery. It is done under local anesthesia, and patient can use their hands from the immediately after surgery. There is no need to immobilize the hand for long. Now, this is the most common topic which I need to discuss with each and everyone in my program today. It's a repetitive strain injury. It's quite common thing in today's era. Like many of the young people comes to my OPD complaining of back pain, neck pain, shoulder pain, elbow pain, wrist pain, and they say, like one of the doctors have told them that they are suffering from cervical spondylosis or by lumbar spondylosis or the frozen shoulder. But in reality, it is not so. It is just a repetitive strain to that area which causes pain. And those repetitive strain is mainly because of the faulty workplace, workplace situation. For example, it is more common in like desk job or IT sector. There is a poor workplace design and faulty posture. I'll be discussing about this in the next slide. For example, you can see in the diagram on the right hand side, this guy is sitting with the laptop and his head level is quite below, which causes a repetitive strain on the back and the neck, and this causes the pain, which he thinks that it's a spondylosis, but it is not. Again, people who continuously use the traditional mouse, it causes repetitive stress on the wrist and the wrist of the hand, causing wrist pain. So what is the management? We need to focus lots on workplace ergonomics. And this should be the ideal position of the people working on the desktop. They should sit erect. You can see that the angle between the waist and the leg is around 90 degree. The computer, the PC level should be along the eyes. You can see it should not be quite up or quite down. So that all these positions causes less strain over the neck and back, causing less pain. Lots of ergonomic keyboards are available in the market nowadays, which is undulated, which reduces the pain on the fingers and the palm area. You can see in the diagram on the left. So there is no strain in this kind of keyboard, and it reduces quite a lot of pressure in the other part of the hand, reducing the strain. We also have an ergonomic design in this keyboard, this is mouse pad. You can see here. So in the distal part of the pad, there is a gel-filled area. So this gel-filled area, it gives less pressure on the wrist area, and hence the repetitive stress on the wrist is less, hence causing less pain to the patient. Earlier, you can see this traditional mouse pad. There is no gel area, which causes repetitive strain on the wrist, causing the wrist pain. This is one of the example of the ergonomic mouse. This also like people who play lots of game online. For them, it's a very good model. It's a rubbery, spongy sort of mouse, and it gives quite comfort to the hand. And the repetitive strain on the hand and the wrist is avoided, causing less pain. So in summary, the hand ailments are not uncommon in India. It's quite common disorders. Early recognition of problem is essential. The diagnosis is either by thorough history or clinical examination and by diagnostic test. Mainly, these repetitive strain disorders, we can like avoid them by lifestyle modification, having good workplace ergonomics, by wearing exercises, by doing exercises, wearing splints, medication in chronic cases, and in some rare cases where there is no improvement with conservative measures, we can go with surgical remedies. Thank you for the patience hearing. Thank you.
Thank you, Dr. Pratik. It was indeed a very in-depth presentation that you made of the various ailments concerning the hands, and also the common ones which are these days very pertaining the growth of IT sector in India. You will have a lot of these patients coming to your OPDs, as you had mentioned. So, Dr. Pratik, my question to you pertaining to this topic is that once we have a disease, okay, we start to have pain and other things, and we have to visit an orthopedician clinic. But if suppose everything is all right, but still, as we know in our day-to-day lives, we are all used to working on computers, on mobiles, and that is a part of the work schedule. So how to take care of your hands such that you don't fall in this cycle of getting an ailment and then going for treatment. So on prevention grounds, आप क्या सुझाव देंगे हमारे audience को?
It's a very good question, Dr. Gaurav. See, like a preventive is better than cure for any ailments. But in today's era, the most common thing which is causing an ailment is the use of mobile phones. All the mobile phones, you can see, they keep on, like usually the females, they usually keep their mobiles in hand and they move around keeping the mobiles in hand. And even the young people, they keep on using the mobiles with their fingers without any reasons. Even late night, they keep using their mobiles for long and in a faulty position, like there is no proper light in the room. They keep 2 or 3 pillows under the neck, and they keep on using the mobiles for the long. So my advice to everyone would be, okay, mobile is an essential part of our life nowadays, but it's better that we use it to, we don't use it unnecessarily. It can be used only when necessary, like excessive use of Facebooks or any other this social media should be avoided. Even in night, if one is using the mobile phone, the light source or the room light should be adequate. The pillows which they are using should be soft, and it should be at a proper level from the eyes. It should not be like you are like bending too much neck, or excessive use of these fingers for the mobile is again harmful. So yes, so excessive use of mobile can be avoided, like which is very common thing today. And other than that, for people who are professional and are using their hands regularly, for example, professional gamers, they can use ergonomic mouse, which I was already describing to you. So using that kind of mouse, it gives less stress on the hands and fingers than the traditional mouse, which we have been using for long. And even the writers who writes a lot or who type a lot, they can take short breaks in between while typing or writing. And all this will reduce pressure and stresses on the hand, and which will prevent a common hand ailment.
Very nicely explained. So Pratik, as we can conclude, we can say we cannot take our hands for granted.
Right.
We have to take care of them like any other part of the of our body. They're equally important. And if we ignore them, then slowly but surely diseases may step in and make life a little more discomfortable. But as
Right.
Dr. Pratik also explained, that there are cures, and any person who has these ailments, or any person uh, who is known to us has this ailment, should not delay it for the situation to become worse. So thank you, Dr. Pratik, for taking a valuable time out and explaining all of us about this very, very important issue of the present era. So thank you everyone for joining us.
Thank you.
Thank you everyone for joining us for this webinar session. So next week again, we will reassemble with a new topic, with a new session. Till then, take care. Have a great Sunday. Namaskar.